Okay, good day to all viewers. Welcome back to another episode of Watson's live chat. And for those who have been following us, we had many live chats. And the last topic that we had was eat well, live well, viewers. And today we are going to talk of another topic which is going to take your breath away. Okay, wondering what it is? It is about smoking, myths and fact. And before I go on further, let me introduce myself. I'm Raman, pharmacist from Watson KLCC, and we are privileged to have with us today Associate Professor Dr. Mohd Haniki Nik Mohd from Kuliah of Pharmacy, International Islamic University of Malaysia. Welcome, Prof, to the show. Right. A bit of Prof's background. He's an expert in clinical pharmacy and he specializes in tobacco control. And Prof has been the chairperson for Malaysian clinical practice guideline on tobacco treatment use disorder. Okay, and do pay attention, viewers, because we have quizzes for you and goodies to be given away. Okay, we have got a Listerine here and also a blood sugar monitoring for you guys. Okay, so stay on, tune in and see with us, and please be free to give your feedbacks and comments. Okay, Prof, we will start with a bit of statistics in Malaysia. Okay, in Malaysia, smoking kills about 20,000 people yearly, and we have a high prevalence of male and adolescent smokers. This is quite worrying, Prof, because apparently adolescent smokers, one who starts smoking during this period of age, is one who's going to be more addicted to nicotine or cigarette, and they're going to be daily smokers as opposed to one who's picking it up in a later stage of their life. Okay, and tobacco is the single greatest preventable cause of death in the world, right? And we will be looking into some of these issues in much detail later. And on smokers' view, Prof, most believe that stop smoking is a matter of willpower, and they are not aware of effective treatment for health quitting, right? Okay, often we associate smoking, tobacco to smoking, Prof. Okay, and what are the other types of products that we have in the market? We see a lot of trendy things coming around. So can you just highlight of what are the tobacco products?
Okay, sure. Good afternoon, viewers. For tobacco products, there are, of course, other than cigarettes, which is the most famous, we have other products like pipes, cigars, or called it churut, but of late we also start to seeing this hookah or shisha, which is supposedly Middle Eastern influence, but the latest one is definitely the e-cigarette or electronic cigarette.
Everywhere now.
So maybe you can show the picture to our viewers.
These are the pictures here, viewers. We have the cigar there, the EC, and also the shisha. You can see them everywhere, right? Okay.
And just to note, Raman, the main thing about tobacco products is because they deliver nicotine. And do be cautious that although some e-cigarettes manufacturers or suppliers are saying that they are free of nicotine, we have evidence to show that their juice or e-liquids do actually contain nicotine.
Oh, indeed. Right. Okay. So it's not it's not just a leisure thing, but it contains nicotine in it. Okay, so do take note of that, viewers. Okay, we'll go on to the quiz now. Okay, vaping or electronic cigarette are safe because they do not contain nicotine. True or false? Log in your answers now. Okay, and we have prizes waiting for you guys. Okay, right, and so Prof, we do see cigarette boxes everywhere now, right? And we see pictorial warnings in these cigarette boxes. And most of them are cancer, pictures of cancer, lung cancer, miscarriages, gangrene of the food, and very gross kind of pictures, right? So what is not depicted in the pictures are some of the chronic illnesses, which I think a lot of viewers may not know. So I think it's a good opportunity for us to highlight to them what these illnesses are.
Right. Okay. Please beware that actually smoking can affect any parts of the body. It damages any parts of the body. Of course, people are more accustomed to respiratory effects or breathing effects, and cancers, yeah, like lung cancer particularly, but there's also oral cancer, neck cancer. And do note that cancer is doesn't need to be confined to just the lungs,
Right.
because once you get cancer, it can spread all over the body, including having cervical cancer, you know, and evidence has shown that it's also associated with breast cancer and even bladder cancer.
So
you
it's
know?
just not just having a primary cancer, but
Yes.
it
It can be any type of cancer. And other than that, there's also effect on the reproductive system, that because it affects the quality and the quantity of the sperm, and also it predisposes women smokers to of their ovum, and then they can have problems with conceiving, and they can also have an earlier menopause. Other than that, smoking is also associated with getting osteoporosis.
Okay.
You know, the brittle bones.
bones,
Yeah, so the many things. In fact, smoking can affect from the tip of the head to the toes.
What
you
about
know?
blood pressure? Prof?
Definitely, because smoking, particularly nicotine, can affect the what you call that, the narrowness of the blood circulation. So as your blood vessels get more constricted, so the pressure goes up because of the resistance. Yeah,
And it's compounded with if you have other cholesterol and stuff.
oh,
right?
definitely.
Okay.
Yeah, but don't forget, there are evidence coming up showing the relationship between smoking and other chronic diseases like diabetes. Like you're getting more prone to get tuberculosis.
Right.
Yeah, so there are many more diseases associated with
Diabetes
smoking.
as well, right?
Diabetes
Okay,
as well.
okay.
Yeah.
Right. And it's when one who has diabetes and is smoking, it's harder for them to control the sugar as well. It makes it
Definitely.
more harder, right?
Yeah,
Prof?
definitely
Yeah.
harder.
Okay, so it's quite informative, because apparently we are very confined to the fact that smoking only causes cancer, miscarriages. But again, what is to be understood here is it has got other chronic illnesses that it poses risk to one. So please take note of that, right? Okay, viewers, for those who have just joined us, we are having a live chat on smoking myths and facts, and I am Raman, pharmacist from Watson KLCC, and we have here our guest Prof Haniki from International Islamic University of Malaysia, who is a specialist in tobacco control. Okay, all right. Okay, we shall go to the next quiz. Okay, is the risk of developing diabetes higher for an active smoker than non-active smoker? Okay, all right. There are goodies to be given away. Stay with us. Log in your answers. Okay. Okay. Moving on, Prof. Okay. Okay. What we would like to see now is a gross anatomy of a cigarette. Okay. Basically, we all know how a cigarette looks like, right? Okay. This is basically the filter and the paper roll which contains tobacco. But have you all wondered what is inside a tobacco? I'm just going to break open this cigarette. Okay. So what you see here is basically shreds of tobacco. Grossly, that's what you see. But microscopically, viewers, have you wondered what can contain in an average size of a 7 cm tube of cigarette? Okay, what it contains is 7,000 chemicals. Okay, and of the 7,000, 70 cancer-causing agents or carcinogens, we call them technically. And of the most talked ones are nicotine, tar, carbon monoxide. All right, and Prof, this is the conventional cigarette that we are talking about. What about shisha or electronic cigarette? How is it different in this context, and what are the health effects of such chemicals?
Okay, thank you for the question. Two parts of the question. One is comparing shisha, another one is e-cigarette to conventional cigarettes. Of course, the most dangerous ones would be cigarettes, because it contains, as you rightfully said, 7,000 chemicals, harmful chemicals, with 70 cancer-causing agents. So if you want to compare anything to cigarette, that's why some manufacturers say okay, the tobacco product is less dangerous, but it's comparing to cigarettes.
Right.
Yeah. So, but the World Health Organization actually said that all tobacco products are dangerous.
Right.
No exception. When you talk about shisha, the misconception or the myth is because the smoke passes through water, so it's somewhat purified or filtered. So that's not true at all, because when there's smoke from tobacco, it definitely contains, as you again rightfully mentioned just now, carbon monoxide and carbon dioxide. There's also tar and also nicotine. So nicotine is the one that causes addiction. Carbon dioxide, of course, is a poisonous gas. Yeah, it will kill cells. It associated with stroke and aneurysm and many other circulatory problems, and also respiratory. Tar is the main thing that is related to causing cancer. So if you use shisha, which is a form of tobacco product, your risk is going to be either higher or similar. It can be higher depending on your session, because shisha session can be prolonged.
Yeah, they can just sit hours shisha.
For hours,
right?
definitely.
Yeah.
So, and the amount of smoke ingested would determine the amount of dangers posed to the user.
So it can be even more dangerous than
It can
cigarettes.
be, yeah. Study has shown that the blood nicotine level in an individual after a shisha session can be similar to a person who smokes 10 sticks per day.
That's a lot.
That's a lot,
Yeah.
yeah. And now you want to compare electronic cigarettes.
That's right.
Okay. Now electronic cigarettes again use manufacturers use this analogy of comparing conventional cigarette to their product, saying that because it's not burned, there's no tar, there's no carbon dioxide or carbon monoxide. Yes, that's true. Because e-cigarette delivers nicotine in a vaporized or aerosolized form. Okay, so therefore it doesn't have the tar to a certain extent, or the carbon dioxide or monoxide. But nicotine is nicotine. It's still addictive. And on top of that, the newer agents, the flavoring agents, also contain vehicles like propylene glycol, ethylene glycol. These can be respiratory irritant. They can irritate the respiratory system, and they can also cause problem in the long run. The issue is we don't know what's the long-term health effects, because it's a relatively new phenomenon. It's like cigarettes. We know the effects of cancer after 30 years. So are we willing to take the risk of another 30 years and find out that e-cigarettes also dangerous? I don't think so. Yeah.
Okay, Prof, let's see if we have got any questions from the audience now. Okay. All right. Okay, we have a question from Miss Yap here. She's asking whether she's heard smoking can help slim down. Is that true?
Okay.
That's an interesting question, because a lot of them say, smoking does help slim down. So
Yes. There's always a common association between smoking and slimming effect.
Right.
Yes, and there's the no.
Okay.
So the yes part is that yes, nicotine can release chemicals that would then suppress appetite. In the brain of human beings, we have what we call appetite center. So this appetite center is suppressed with chemicals produced by nicotine stimulation. So to a certain extent it's true. But on the other hand, the effect is not prolonged. Yeah, because nicotine half-life, or the amount of time it is around the body, is relatively short, 1 to 2 hours. So after you have stopped smoking, then the appetite suppression is no longer there. But if you continuously smoke, and if you don't eat, of course you'll be slim. Yeah, but the problem is, for some smokers, they take cigarettes, but they don't watch their diet in particular. So there's no point. You're harming the body by pumping all these chemicals, trying to get slim, but you're developing cancer, you're developing cardiovascular disease, and developing chronic respiratory problems. It's not a healthy way to be slim. Yeah, of course people say, if I smoke continuously, I don't eat, I'll be slim. Yeah, anybody who don't eat will be slim.
Slim,
Yeah,
okay.
but that's not the right way to be slim.
Right,
Mm.
right. So it poses a lot more risk
Yeah,
than just the stimulating effect that we're
So
talking
get
about.
professional advice on how to reduce weight and control weight effectively. Ask your pharmacist.
Okay, right. Moving on to against shisha and electronic cigarettes, Prof. We know that flavors are categorized as food grade, okay, and they are classified generally recognized as safe, GRAS.
Okay.
Okay, and these flavors we get to see in a lot of food that we take. You know, we enjoy the flavors, and the flavors are made in such a way that when we take them and when we eat them, we are able to digest them. Human body or human stomach is made to digest them.
Yes.
But what happens when these chemicals in shisha or electronic cigarette gets into the lung of one? Is it safe, or is a lung able to so-called digest these chemicals?
Right.
Can you comment on this, Prof?
Okay. Thank you. You rightfully said that it's generally recognized as safe for ingestion,
Right.
for eating. You have strawberry flavored drinks and cherry flavored cakes, fine.
Yeah.
You bake them or whatever and then you swallow them. However, the flavors in electronic cigarettes are again vaporized or in aerosol forms, and they are actually absorbed in the mouth and in the lungs, respiratory. Our respiratory systems are not meant to absorb these flavors.
They can damage the
Yes,
cells.
as I've said earlier, some of the chemicals are irritants. And then, more importantly, evidence shows that some of the vapors contain chemicals like diacetyl. Diacetyl is a chemical detected among what we call people who work in popcorn factories, because they use butter, and then as you know, there's glycerin or vegetable oil or fat in the making of e-cigarette liquids.
Okay.
So anything fatty like this, when it's vaporized, it can produce diacetyl. Those popcorn factory workers were diagnosed with a lung condition, called bronchiolitis obliterans, or simply said popcorn lungs. Like you have all those chunks of popcorns, but it's in the lungs. So this would render the lungs to become ineffective. So, and in fact, some of them were so severe they had to go for lung transplant, the only option. So the main thing that viewers need to know is that we are looking at the emerging chemicals from this new device, because I've said earlier, it's a relatively new phenomenon. So we don't know much about the chemicals produced. So as time goes on, we're going to see more and more chemicals and their effects on our body. So not just the diacetyl, there's also formation of formaldehyde, because this depends on the voltage, the resistance, and how one alters the electrical conductivity of the electronic cigarettes and the amount of vapor produced. So dangers in the form of cell cytotoxicity or the killing of cells in the body can happen. And scientists have discovered even flavorings like menthol, coffee, and even fruity flavors like strawberry flavors have high amount of chemicals which can kill the cells. So it's very dangerous, Raman.
Right. So it's very informative, and a lot of research need to be done on this in order for us
Continuously,
to further understand how lungs is able to metabolize these sort of chemicals, right? For those who have just joined us, we are having a live chat on smoking myths and fact, and I'm Raman, pharmacist from Watson KLCC, and here we have Prof Haniki from International Islamic University of Malaysia, who specializes in tobacco control. Okay, we shall throw our third quiz now. All right, cigarette smoke contains 7,000 chemicals. Viewer, is this true or is it false? Okay, you can log in now your answers, and we have goodies waiting for you guys. Okay, please stay tuned. Right. Okay, we will see if there is another question from viewers. Okay, we have a question from Amesha Maslan. Okay, Prof, could you explain on the third-hand smoke effect of the people living in the same surrounding. Okay, we're going to address this much later, Prof, because we will come to the
Third-hand
discussion.
smoke.
Yeah,
Okay.
we'll come later
Okay,
to that.
definitely.
Okay, and okay, we are there now, right? Okay. Okay, many times, you know, Prof, all of us would have experienced this. We would have just walked into an elevator or you know, a public toilet, or even hop into a friend's car, and we would have, you know, wondered why it smelled like someone who's just like smoking in there, right? But there wouldn't be any smokers inside, right? So there is this cocktail of toxins which is like, you know, lingering on the fabrics, on the, you know, surrounding objects, you know. So what is this? What do we call these lingering toxins, Prof? This is a relatively a new concept, right?
Okay, thank you. I think the viewer actually asked about third-hand smoke.
Yeah,
I think
coincidentally,
people are probably more accustomed to hearing second-hand smoke,
right?
which is the inhalation, involuntary or forceful inhalation of cigarette smoke or tobacco smoke from burning cigarettes and also exhale cigarette. That's second-hand smoke. When you actually see somebody smoking and you actually see the smoke. So second-hand smoke effects are also fairly established. From cancer to cardiovascular, that one established. We have evidence. The newest one so far is the third-hand smoke. It's when the smokers is already left the environment. We don't see any smoke, but we can smell it. And then the particles are left behind. They are immersed in curtains or sofas or cushions or carpets or even the surroundings and whatnot. So these are called third-hand smoke. And studies have established the formation of third-hand smoke due to the reaction between nicotine and the nitrous oxide and the ozone in the environment. So this is what you call naturally occurring. Yeah. So and then scientists are looking at the effect of third-hand smoke on humans, because again this is fairly new. But studies have shown that there are more than 50 volatile organic compounds airborne for at least 18 hours. So that's a lot of compounds and for a long time in the environment, which can expose anybody, you know, after the smokers are gone. But if they have particles embedded in their clothes, and they pick up their son or their child upon seeing them, that child can be exposed to the third-hand smoke particles.
Okay, just to add on, Prof, you know, the kids or children are much likely to ingest this more than an adult, probably 2 times the amount, because they are more closer to this sort of objects, and not only that, their hand-mouth, hand-object behavior that they have further makes them more prone to the, you know, toxicity of these chemicals. Not only that, they do have higher respiration rate, they grow very fast, so they ingest a lot more than any other adult would, right?
You're correct.
So, you know, smokers, you know, who have kids at home, don't think it's safe, you know. We are not talking about second-hand smoke now, it's like third-hand smoke, guys. So be aware of what's happening around, okay? And okay, we have another question now, okay? Smell in carpet, sofa is considered as first, second or third-hand smoke. Okay, you can log in now and give your answers, okay? Alright, okay, Prof, let's move on to nicotine dependence now, okay? We know of a lot of substance abuse, right? Like cocaine, morphine, heroin. Okay, we well know that these substances cause a lot of addiction, dependence, and how is nicotine compared to this substance? We often think nicotine is, you know, just, you know, a common cigarette that we pick up and smoke. It doesn't cause addiction. How does it compare to, you know,
these other
the substances that we're talking about?
Actually, that's another myth that we have to debunk. The nicotine in tobacco product is actually a very addictive substance. So addictive that addiction specialists like Hanningfield and Benoit's rated the ability to cause dependence that by nicotine is higher than that as compared to heroin or cocaine. So I have to repeat. This addiction specialist, they rated nicotine ability to cause dependence to be higher than that of heroin or cocaine. So imagine that. Yeah, it's just that the nicotine available in cigarette is sold openly. So you would have this mindset that, oh, if it's not, if it's sold openly, it cannot be that dangerous. But in fact, it is very highly dependence-causing chemical.
Okay. Basically, you guys can log in and just randomly answer this, question. Okay, which do you think causes the high dependence? Okay, all right. Is it nicotine, cocaine, heroin, or marijuana? Right. Okay.
So now, knowing that nicotine is a very dependence-causing substance, then we can understand the mechanism of addiction, because once nicotine is inhaled, particularly from cigarette, it will go to the brain very rapidly, within 10 seconds, and it will reach a high level in the brain, and it will occupy specific receptors in the brain. You can show the picture here that nicotine has a very high affinity, to certain receptors, what we call it receptors, in the brain, particularly nicotinic acetylcholinergic type receptors. So my analogy would be saying that in our brains we have angry birds. So nicotine would be a substance that would feed these angry birds. So the adolescent brains particularly are responsive to nicotine and its effects. In fact, studies have shown that you don't need many cigarettes to occupy all the receptors in the brain. You want to guess how many sticks will occupy all these receptors?
Probably 1, 2.
3 actually. Studies have shown, as in this picture here, 3 sticks of cigarettes will be enough to deliver nicotine that will occupy almost all the receptors in the brain. So that shows how strong addiction potential of cigarette is.
Okay, we will see another question from audience now. This is from Ashley. I need to smoke once I wake up early morning. Does it mean that I'm mildly addicted?
Ashley said to say yes. It sounds like you're very highly addicted, because time to first cigarette is one of those parameters that we use to determine your level of dependence.
How long a duration would that be?
Within 30 minutes actually, Raman. If somebody smokes within 30 minutes of waking up, that person we consider as nicotine dependent. The faster you smoke upon waking up, the higher your level of dependence to nicotine.
Alright. Having understood the mechanism of nicotine addiction, and we will go on to how to assess nicotine addiction, and what are the methods of quit smoking. Alright. Probably you can tell us on this, Prof.
I mentioned just now regarding the mechanism, and one of the questions that we use to assess level of nicotine dependence. So actually there are 5 other questions when we call what we call under Fagerstrom test for nicotine dependence, the specific for cigarette smokers. So the question of time to first cigarette is most important, because we can actually correlate that very well with their level of nicotine. And to answer your question regarding methods of quitting, because nicotine causes dependence, and what we have currently, evidence-based treatment that also on one hand use nicotine as the method of helping smokers quit effectively.
So these are called nicotine replacement.
Nicotine replacement therapy, correct. So it's clean nicotine, without the tar, without the carbon monoxide, without the carcinogens. It's just nicotine, and it's approved by Ministry of Health as well as other health agencies in other countries to be used as first line agents to help smokers quit effectively. The use of nicotine replacement therapy, for example, has been shown to double the success rate of quitting.
Okay. Probably we can take a look at the gums first, Prof.
Okay.
Right? Okay, and these are the gums that we are talking about. Okay, basically they're gums containing either a 2 milligram or a 4 milligram nicotine. So when do we use a 2 milligram and when do we use a 4 milligram, Prof?
Okay, we use the Fagerstrom test to help us gauge the level of dependence. If you can show the viewers, at the bottom of this, you have the scoring from this total of 6 questions. The minimum amount that you can get is 0, but that will bring the question, why are you smoking? But if you get 10, it means you have the highest dependence. Yeah, so you definitely need the higher strength of medication. So if you fall, for example, under low to moderate, the lower strength, which in this case is 2 milligram, would be preferred if you are suitable enough to use the medication. On the other hand, if you have high dependence, or moderate dependence, you can consider the 4 milligrams. So we also take into consideration this scoring and also your preference, other than safety and efficacy data. Okay. Of course, gums. When we talk about suitability, used for people who probably can chew gums in their environment. But if you are like, you are a pharmacist, you should not be smoking in the first place. But for people like people who work with people, like at the counter of the post office, it's very difficult for them to chew the gum. Because they have to use it. Not practical. They have to use this about every 1 to 2 hours.
Okay. The chewing gums are not just like any other chewing gums. There is a special technique that we have to adhere in order for us to maximize the success rate, effectiveness. And how do we chew is basically each gum, like Prof said, it contains nicotine, omitting all the other chemicals. And we normally do a chew and puff method. Okay, what we do is we will chew the gum slowly for about say 10 times, and as we chew, the taste becomes more intense, and you feel a bit of tingling in your mouth. That shows that the nicotine is being released from the gum. Okay, so when that happens for about 10 chews, what we do is puck it then between your gum and teeth, and when that pucking happens is when the nicotine that is released from the gum will get absorbed into your bloodstream. Bear in mind, viewers, the nicotine is one which get deactivated if you swallow them. So that's the whole point of chewing very slowly, because when you chew very slowly, you want to produce as little saliva as possible, so that there's very little chance of you swallowing them. Alright, so puck and chew for about 30 minutes. Repeat the cycle. Within 30 minutes, you probably ensure that all the nicotine from the gum would have gone into your bloodstream. And normally, 15 minutes before you chew and during chewing, do not take any acidic beverages like caffeine-containing beverages or juice, which will reduce the absorption of.
Or soda drinks.
Soda drinks as well, right? So basically that's how you chew a nicotine gum. And let's look at the patch now, Prof. Okay.
If I may add, just before we go to the patch, as I said, you can use it on a scheduled basis. So you can use it as frequent as 1 piece every hour. So if the smoker doesn't sleep at all, maximum number of gums chewed per day will be 24. But usually, they will take around 20 or less gums per day, and they tailor it. They tailor it to their needs. It's good because it's flexible, and you can chew 1 gum for about 30 minutes or even 1 hour. So that by the time all the nicotine is absorbed, then you can chew another one, discard the previous one. So study has shown that if you use on a scheduled basis rather than an as needed basis, the success rate is higher with schedule.
So also to point out point out that at least 9 gums a day would be needed for
at
them
least.
to be, you know, effective. Because if you are going on a craving basis, very high tendency of one picking up a cigarette, right,
Yes,
Prof? Right?
yes.
So we want to keep that blood level of nicotine maintained, especially in the first 8 weeks where we are going to thoroughly, you
Yes.
know, basically how this nicotine replacement therapy works is actually we can probably go on a cold turkey, but again, cold turkey would not be very practical because the nicotine levels will just drop deep down and you have a lot of withdrawal. So basically we are desensitizing our body by tapering down the dose. Is that
Yes,
right, Prof?
yes.
Yeah.
And those who quit cold turkey
Yeah.
and then take the gums, for example, to reduce the withdrawal symptoms.
Okay.
Yeah, they can quit cold turkey. In fact, we warn smokers to quit
Right,
cold turkey
right.
to reduce the withdrawal. That's the whole point of
Yeah.
using the
Yeah.
medication, is to reduce the withdrawal symptoms
Right.
and therefore increase the likelihood of successful
Successful
quitting.
quitting.
Yeah.
All right. With that, we can move on to the patch now, probably. Okay, this is it comes in 3 different strengths, Prof.
You can
Right?
show the
Okay.
viewers.
And this is how a patch, how you should use a patch. Basically, you put on the patch first thing in the morning after you have woken up, and you pull it off last thing before bedtime. It's like a 16 hours nicotine release from the transdermal patch. This is not just like any other ordinary patch. It has been designed carefully to deliver nicotine in a very gradual, release form. And where you could probably patch, Prof, is it any place, or can you just put it on any
Yeah.
specific places?
Okay, we usually advise smokers who want to quit using the patch to put the patch on an area which is not so hairy,
Right.
dry, clean, and not oily.
Okay.
So if you want to put it in the morning, put it probably after shower. Then you dry your skin. Don't put any lotion or talcum or anything. Just natural. And then peel off the back of the patch. Peel it off like that. It's just like putting on a handy plus
Right.
or plaster. Then you can put it on, take this away, and then you can see the patch inside here. Yeah. Then you can put it on. The dry, clean, not so oily, not so hairy. Just usually the upper arms here, upper shoulders. Yeah. Some people put it on their chest or on the back, as long as it's not hairy. Because if you want to take it off, it might be painful if you have lots of hair. I have not seen anybody who needs to shave
For that.
to put on a patch. But anyway, some people will also put on their hips.
Okay.
Yeah, it's okay as long as those conditions are met. And we usually at our clinic, after we peel it off and put it on, we seal the edges. We just press it and seal it to make sure it stays on. It has very strong adhesiveness.
Right.
So if you want to go swimming, yeah, you can. If
So
you
it's
need
okay
to,
to
it's
shower
okay
and
to
swim and
shower.
all.
Yeah.
All right.
For the Muslims, you only need to take it off if you need to take your compulsory shower,
All right.
mandi wajib.
Okay.
The non-wajib one, no need to take off.
Okay. Okay. Talking about, we can probably address this on fasting month. Can nicotine be used during fasting months? Is this considered, okay,
Permissible or not?
permissible?
Yeah.
That's right.
Of course, the only NRT products that's permissible to be used during fasting month is the patch.
Patch.
The patch, you can chew the gum that would nullify or make the fasting void.
Okay.
But the patch, no problem. You can put on the patch and continue fasting as usual. But do adhere to the manufacturer's recommendation. For example, no smoking, not for children,
Yeah.
under 18 and
Yeah.
things like that.
Yeah.
So just pay close attention to it.
All right. Also, it's not only not to be used in serious heart conditions. Okay, pregnant, breastfeeding. But however, in pregnancy, if there is a need to use, you have to consult your doctors and pharmacies, because apparently smoking by itself can pose a lot of risk to the growing fetus, and therefore there has to be a risk and benefit ratio that has to be weighed before we can possibly tell a pregnant mother to use or not to use. So that is specific conditions that you probably want to,
Discuss with your
discuss with
doctor
your
and the
doctors.
pharmacist.
And it's not for non-smokers, okay? It's not
Definitely.
trendy like shisha, okay?
No,
So
no.
no to
Yeah.
non-smokers.
And
Alright.
if I may add, Raman, for example, on your first day, because you have to, again, like the gums, you have the tapering down, like
Yeah.
the 8 weeks of the highest strength,
Right.
and then the medium strength, and then the lower strength. Are you
Right.
going to explain that?
Oh yes,
okay.
back to that again. Basically, it comes in three different strengths,
Right.
like 25 milligrams, 15 milligrams, the mid strength, and the 10 milligrams being the least one. Okay, basically we start 8 weeks of the first step. We call it first step because that's the highest strength, and then subsequently 2 weeks of the mid strength, and the lowest strength for the last 2 weeks. Basically, the principles are the same. You're going to taper down the dosage as the time goes by, and can we add the patch and the gums, doctor?
Of
In what
course.
circumstances do we do this?
Yes, very good question. Nowadays, we are seeing more smokers in need of combination therapy of the NRT. And evidence has showed that the combination therapy of using a patch as a baseline, and on top of that, when the smoker uses the gum, the success rate of quitting is even higher, Raman. So we highly encourage smokers to use combination therapy when it is appropriate.
Right.
But you need to see your pharmacist to assess you whether you are the ones who would require combination or monotherapy, meaning that using just either one. When you use combo, you put on the patch either at night before you go to bed, if you smoke within 30 minutes of waking up, or you can put the patch as first thing in the morning, as mentioned. Then you go out through the day, and when you have cravings that you cannot control,
Right.
you try a lot of things,
Right.
but you still want to smoke.
Breakthrough cravings,
yes,
we call, right?
so chew a gum. Then if you still need to smoke, you feel you need to smoke, then chew a gum again after 1 or 2 hours. There has been no death reported or poisoning cases from NRT. You will die or you get poisoned from nicotine in tobacco products, or if you ingest the juice of the e-liquids, because there have been reported cases. Yeah. Another thing about the patch, to minimize skin irritation, make sure that you don't use the same site for about 3 to 5 days.
Yes.
Or if you want to be safer, if you have sensitive skin, like some people I know, you avoid using it at the same site for about 7 days or 1 week. So for example, first day here, second day use another patch, don't use the same patch. Put another patch, new one on the left side. When you want to go back to the right upper arm, move it to another side that you have not used before. So keep moving it. Yeah.
So we can go back to the same side perhaps after a week.
Yes.
We rotate the sides.
Yeah, that should
right?
be safe.
Yeah.
Yeah.
Okay. Okay. Now moving on to more questions from audience. Okay. Let's see what we have here. It's from Wong Wai Kate. Okay. How much nicotine is there in your average cigarette? Prof?
Okay.
Okay.
Good
Compared
question.
to what we are
Yes.
probably
Yeah,
using in an NRT.
probably Kid, was it?
Kid, yes.
was asking because he noticed we said this one is 2 milligram, this one is 25 milligram. So he said, probably there's a lot of nicotine in all this product. No, because although it's 2 milligram, not all 2 milligram is going to go to the receptors or what we call it bioavailable. You know, it's going to be used by the body. Some of them are going to be excreted or cleared. Similarly with the patch, this is 25 over 16 hours, so very slow and low. Chances of again poisoning and whatnot is low. With the cigarette, usually it's 1 milligram per stick. So although it's low, but remember I said earlier on in the program that the characteristics of causing addiction is that it needs to reach a high level of nicotine in a very fast or rapid delivery manner. So far, nicotine from tobacco products, particularly cigarettes, are the one showing these characteristics, meaning that upon inhalation, you can get high level of nicotine in a very short time. If you take the gum, it's not going to reach the brain in 10 seconds. Much more time needed for the patch. So these characteristics unique characteristics of these products prevent people from getting addicted to NRT. So on a level of milligram per milligram, yes, per stick of cigarettes has low nicotine. This one seems to have more. But in terms of causing dependence, cigarette is the most effective dependence to nicotine causing product that we have in the market today.
Okay, well explained, Prof. Okay, and now we will look into people who are contemplating to stop smoking but they're not ready. And what are the things that we can probably do for them? Actually, we can probably ask them to eat healthy, take a lot of antioxidants such as vitamin A, C, E, Prof, to help them counter the damages. And for oral hygiene, we can use, mouthwash, honey for, throat irritation. These are the tips that we have for, smokers who are contemplating. So, so we will wrap up the live chat today. Okay, I'd like to thank Prof for having to be with us today.
My pleasure.
And the information provided is intended solely as a guide, and all health facts and information contained herein should not be substituted for a medical advice from your practitioners. So viewers, thanks for being with us. Stay tuned for our next live chat. Okay, thank you. Thank you, Prof.
Thank you for having me.